Greetings, dear learners. In the last class, we covered the management of acute alcohol intoxication and learnt about the various features of the chronic alcohol poisoning. Today, we shall learn the remaining part of the alcohol intoxication. The management of chronic alcohol poisoning or alcoholism, treatment of withdrawal symptoms is the one of the important part. For the treatment of the withdrawal features, in addition to the previously outlined treatment for the several withdrawal symptoms like administration of phenothiazines like chlorpromazine for the alcoholic hallucinosis, benzodiazepines for the seizures, and the correction of electrolyte imbalance in case of alcoholic ketoacidosis, and thiamine therapy for the management of Wernicke-Korsakoff psychosis. We need to additionally administer carbamazepine that is effective in the treatment of the alcohol withdrawal. Apart from that, clonidine and the GABA hydroxybutyric acid GHB has the promising results. Clonidine is given at the dose of 60 to 180 microgram per hour IV, and the GHB is administered orally at the dose of 50 milligram per kg. Then the tripride is the recent addition in the management of the chronic alcohol poisoning. It should only be used as an adjunct while managing the seizures, hallucinosis, and others. It is effective in alleviating the psychological distress associated with alcohol abstinence. It is recommended in the dose of 400 to 1200 milligram per day, 6 hourly, with a maintenance dose or not exceeding 300 milligram to aid in the alcohol abstinence. Then aversion therapy for the rehabilitation of the alcohol addict is the additional treatment in the case of the chronic poisoning. Main aim in the treatment of alcoholism is to gradually wean away the patient from the clutches of ethanol once the acute manifestations of the withdrawal has been taken care of. This aversion therapy must be undertaken only under the hospital admission and the close supervision. Base drug that is used for the aversion therapy is the disulfiram. It inhibits the aldehyde dehydrogenase, leading to the accumulation of acetaldehyde that causes disulfiram ethanol reactions. Disulfiram ethanol reactions includes the abdominal pain, nausea, vomiting, blurred vision, confusion, vertigo, headache, weakness, syncope, hypotension, tachycardia, dysrhythmias, chest pain, myocardial infarction, sweating, flushing, sensation of heat, pruritus, tachypnea, and many other features. All these causes patients unpleasant conditions after the intake of alcohol. So now patient will try to avoid alcohol. This is basically the purpose of the aversion therapy. Aversion means to develop disliking for that particular substance. The usual dose of disulfiram is 250 milligram per day, and it shall be administered indefinitely till the patient is no more interested in the intake of the alcohol. Then another drug that can be used for this rehabilitation purpose is the naltrexone. It is an opioid receptors antagonist that blocks the reinforcing properties of the alcohol. Chronic administration of naltrexone resulted in decreased rate of relapse to the alcohol drinking. Also, the acamprosed, that is the competitive inhibitors of the N-methyl D-aspartate NMDA type glutamate receptor that attenuate one of the mechanisms that lead to the relapse. It is also advised to prevent the alcohol addiction. Then the death in case of the chronic alcohol intoxication is the most commonly hepatotoxicity, apart from the other various manifestations that may itself lead to the death in those patients. And the post-mortem examination, although the findings are not very specific, but many features that we already discussed will be seen at the post-mortem examination. Offer history from the relatives with the history of the very long intake of the alcohol, along with the clinical features and the complication that patient has developed over a period of time, are all vital in making the diagnosis of the chronic alcohol poisoning. In case of death due to chronic alcohol ingestion, we may find esophageal varices, gastritis, and the peptic ulcer disease in the gastrointestinal tract. In the central nervous system, there is the finding of central pontine myelinosis and the cerebellar atrophy or necrosis. You can see here in the picture, this is a case of the chronic alcohol intoxication. Here the cerebellar atrophy can be seen very well. Then in the lungs, the findings of the pneumonia, aspiration pneumonitis, and the abscess may be there. Due to recurrent aspiration of the vomits and the stomach contents in the chronic alcoholics, often they fall and they have injuries on the body. So old healed injuries, multiple old injuries may also be seen on these chronic alcoholics. Then fatty degeneration of the heart may be seen, dilated cardiomyopathy that we already see while discussing the acute intoxication. Then bacterial peritonitis may be there. Liver will be the congested, hepatitis, steatosis, and the cirrhosis. All these features we discussed along with the acute intoxication may all be seen in the autopsies of such patients. Then kidney will have the granular degeneration and old health fractures on the bones may be seen. These are all suggestive of the chronic alcohol ingestion. To see the fatty liver chain, we usually see greasiness on the surface of the liver and the cut section. And in case of cirrhosis, the liver is gritty or hard to cut. They have the cirrhotic hard fibrous nodules in case of the cirrhotic. That is what helps us to make the diagnosis grossly at the time of autopsy. Then one of the very important part in the alcohol intoxication we need to know is the drunkenness. Drunkenness, it is a condition produced in a person who has taken alcohol in a quantity sufficient to cause him to lose the control of his faculties to such an extent that he is unable to execute safely the occupation in which he was engaged at the particular time. So just intake of the alcohol doesn't mean the drunkenness. He should not able to perform the function he is going to perform safely. That means he is under influence or he is in the drunken state. Often doctors are asked to examine a person and to opine whether he is drunk or not. This is used for the various medico-legal purposes like public annoyances in a state of intoxication or driving vehicle under the influence of alcohol. Several laws prevents the state of drunkenness from driving. So every doctor must know the procedure for the examination of a case of alcohol intoxication to categorize them whether he is under the influence of alcohol or not. The examination shall be done very cautiously before coming to the conclusion. The smell of ethanol in the breath, the pulse rate, dilatation of the pupil or the color of the face gives no indication of the degree of intoxication. Conclusions shall be arrived only after the detailed examination with a special emphasis to the state of mind, coordination movement, visual acuity and others important features. So we should know the steps of examination in case of the drunkenness. In every legal medical situation, before examining someone, the doctor needs their consent. Consent is a very important topic that every doctor should know when they can take consent and when they should take consent for examination and what are the all legal provisions with respect to the consent. This is a detailed topic that shall be learned by the doctors additionally and taught along with the medical jurisprudence. In case of drunken person, if the person is drunk and cannot give the consent, the doctor can still examine them but should wait to share the results until they are sober and agree. So you examine the drunken person, you make the report but don't disclose to the police or any other authority unless the patient gets recovered and he is now sober and healthy. Then take his consent and then disclose the report to the other person. This is the procedure that shall be followed in case of the drunken person. However, a court order asks you to immediately disclose it, then you have to disclose it. If the person refuses and is uncooperative but has been arrested for the crime, the doctor can examine them without consent with the reasonable force, but only if the request comes from a the request comes from a police officer, not below the rank of the sub-inspector. The doctor can also take the various samples for the purpose of the drunkenness examination, like blood sample, urine sample, and urine sample for the testing the level of the alcohol. You can see the steps involved in the examination of a drunken person. That includes the consent, the preliminary details, that is the details of the patient so that he may be identified, all the identifying features, some identification mark, the name of the person accompanying the patient. All those details shall be mentioned in the preliminary details. Then exclusion of the injuries and the pathological states shall be made, as certain states like head trauma and other disease conditions like diabetic comas, hypoglycemic coma, all those may mimic the case of the drunkenness. So it shall be ruled out. We already discussed the differential diagnosis for the acute alcohol intoxication. All those conditions shall be ruled out before proceedings for the examination. Then the proper history shall be taken. Preferably history shall be taken from the patient himself, even he is not that much conscious. Then also his talk, his behavior, his memory, everything shall be asked from the patient himself and very sparsely from the relatives. Then the general behavior shall be noted, his manner, his dressing, his clothes shall be noted, how healthy, the vomiters and all those shall be noted, his conditions shall be noted, all manners, and the memory and the mental alertness shall be recorded. It shall be asked the time, his place, and the persons around, and he must be asked some chronological events. All those shall be checked for about this memory and the mental alertness. Then handwriting shall be checked. He may be asked to write from the newspaper or on his own some essays. Patient may be given a plain paper and asked to write from the newspaper or an article, and his handwritings may be noted, and that paper shall be preserved and it shall be produced before the court of law, so that it may be compared that at the state of the intoxication, what was his writing and what is the writing in the normal state. It is of very evidential value, and it is not a very subjective features. It can be objectified. The pulse rate, temperature shall be noted, and the condition of the skin, warm, sweaty, and all those other conditions shall be noted. Condition of the mouth shall be examined. The smell from the mouth shall be noted. The eyes shall be looked upon. Eyes shall be examined for all the pupillary dilatation, the different types of reflexes, the strabismus, nystagmus, and all those shall be seen in the eyes movement. Then the ears shall be checked whether he is able to listen or not. Examine the ears for any gross impairment of the hearing. Then the gait shall be seen. To check the gait of the person, he shall be asked to walk, and the walk and turn test may be done. He may be asked to walk in a straight line and then turn around. These all may be done to reflect the status of the gait of the person. Then a stance may be displayed by asking the patient to close his eyes and extend his hands, and his balance shall be recorded. He may be asked to one leg raise test. He may ask to raise one of his legs and stand up, and his coordination shall be noted. And muscular coordination shall be seen. He may ask to button and unbutton his shirt. He may ask to lift the paper from the table or any object. It will be helped to record the fine motor and the gross motor movements. Then the reflexes, knee jerk, plantar movements, and all those other reflexes shall be checked. Then other systematic examination, apart from the general physical examination, that may include the pallor, icterus, cyanosis, clubbing, lymphadenopathy, the pulse rate, blood pressure, heart rate, respiratory rate, all those the basic parameters shall be noted. Then systemic examination for all the systems shall be done. Then certain samples shall be collected for the lab investigation. Lab investigation may include the breath analyzers, the bedside test, and sending the sample in the toxicological laboratories. Then in the eye, we shall examine it properly. We shall look for the visual acuity. We should look for the intrinsic muscles. In that, we should look for the size of the pupil, whether they are dilated or the reflection to the light what is their status, where they are contracting, or what is the moments. Then the extrinsic muscle shall be noted, whether the convergence is proper or not, strabismus is there or nystagmus is there or not. Looking for the nystagmus is the very important in case of the alcoholic intoxication. Nystagmus develops in the alcoholics due to the effect of alcohol on the vestibulocochlear systems. So, nystagmus in the alcohol intoxication is basically of two types: alcohol gaze nystagmus and the positional gaze nystagmus. Alcohol gaze nystagmus is performed with the patient in the sitting position. It is of two types: horizontal gaze nystagmus and the vertical gaze nystagmus. In this, patient is asked to sit, and we asked to look laterally and the medially and upward and downward to look for the horizontal and the vertical gaze nystagmus. Then the positional gaze nystagmus is seen in the lying down position, best elicited with the eyes closed. This is also known as pen. Pen 1 and pen 2 are the two different types of movement with respect to the positional alcohol nystagmus. Patient is asked to lie down on the table or on a seat, and then his head is turned into the right and the left side. If the eye movement is on the same side, then it is pen 1, positional alcoholic nystagmus 1, and if it is on the opposite side, then it is the pen 2. This nystagmus can also help to predict the blood alcoholic concentration in the person as they develop in the different body concentration of the alcohol. Then for the gait, we already talked, walk test and walk and turn test shall be performed. For the stance, Romberg test and the one-leg stand test shall be performed. Then for the laboratory analysis, the breath analyzer is usually the bedside test that may be done. Also, the traffic police personnel advised to carry it along with them and check the blood alcohol level with help of breath analyzers at the site of the traffic incidents. The basic principle behind the breath analyzer is the change in the color of the potassium dichromate, and that color is analyzed by the spectroscopy. By this, they are able to tell the level of the blood alcohol concentration. And we already talked, this breath analyzer works on the principle of the Henry's law, that in the lungs and the blood alcohol, the concentration are the same. So it gives an approximately accurate measurement of the blood alcohol concentration. You can see here the picture of the breath analyzer. Then the bedside test is performed using the mixture of the acetic acid and H2SO4 that is mixed in the sample of the interest, and heat gently for the 1 minute. A strong fruity odor due to ethyl acetate indicates the positive result for the ethanol that we already talked while performing tests for the acute intoxication. Then the blood shall be collected, preferably the peripheral blood shall be taken, and the sodium fluoride shall be used for the preservative, as it will prevent from the glycolysis and normal rise in the alcohol concentration from the blood itself. Then similarly, the saliva shall be collected, as it is easy to collect and non-invasive for examining the alcohol concentration in the body. Then the urine shall be taken. The concentration of alcohol in urine is slightly higher than that of the blood. Blood-urine ratio is 1:1.3. So the urine concentration must be multiplied by the 0.75 to get the blood concentration. Then the samples shall be sent for the toxicological laboratories. We already discussed the methods that are performed in the toxicological laboratories. There, for the alcohol level estimation, the best is the gas chromatography. That is the most reliable method. Apart from that, caveat test and Kozelka and Hein test are also performed. Then you must know the Wittmann's formula that is used for the calculation of the blood alcohol concentration. The formula is A, that is the alcohol ingested in the grams, is equal to the concentration of the alcohol in the blood in decigrams multiplied by the weight of the person in kg, and R is the Wittmann's constant, that is for the male is 0.68 and the female is the 0.55. So by examining the alcohol ingested or by knowing the blood alcohol concentration, we can predict the what amount of alcohol the person has consumed. This is the formula that is called the Wittmann's formula. So this you must know, and many times numerical questions are asked based on the Widmark's formula in your exams. Then after the complete examination, the important part is the opinion formation. For the opinion formation in case of drunkenness, it shall be phrased into the either of the three ways, that is, individual examined has not consumed alcohol, then the individual examined has consumed alcohol but is not under the influence, then the third is the individual examined has consumed alcohol and is under the influence. So we have to rule out all the three conditions and we must write opinion in either of the three wordings. Opinion A shall be given, that is, opinion A, that is, the individual has not consumed the alcohol, shall be given if there is no smell of alcohol in the breath, or the laboratory analysis is negative for the alcohol and all the clinical findings are normal. Then the opinion B, that is, individual has consumed alcohol and is not under the influence, shall be given if there is a smell of alcohol in the breath and or the laboratory analysis reveals the presence of alcohol but the clinical examination reveals the normal finding. So the person has the intake of alcohol but the clinically his coordination and everything is normal. In that case, we shall opine that the person examined has consumed alcohol but is not under the influence. Then the opinion C, that is, the individual examined has consumed alcohol and is under its influence, shall be given if there is a smell of alcohol in the breath and or laboratory analysis reveals the presence of alcohol and the clinical examination reveals the abnormal finding suggestive of that he is under the influence and he is drunken. So in this way, opinions shall be framed in case of the drunkenness. And at the end of paper, there shall be the signature of the examining doctor along with his designation, NMC registration number and full name. Again, this is very important, as something not authenticated by someone, then it is just a waste of paper. So the signature by the examining doctor shall not be forgotten. There are certain important medico-legal aspects with respect to the alcohol. Alcohol intoxication and the traffic accidents has a very important correlation. So the government has framed the law that a person who is driving shall have a limited intake of alcohol. If the limit of the alcohol exceeds, then it is a punishable offence. This is mentioned under the Motor Vehicles Act 1988 in the section 185. This got modified in Motor Vehicle Amendment Act 2019. This act says that whoever while driving or attempting to drive a motor vehicle has in his blood alcohol exceeding 30 mg% of the blood detected in a test by the breath analyzer. So the amount exceeding 30 mg% and that shall be tested by the breath analyzer. This has also been explicitly mentioned and is under the influence of the drug to such an extent as to incapable of the exercising proper control of the vehicle. Here the other drugs apart from the alcohol has also been included, shall be punishable for the first offence with the imprisonment for a term which may extend to 6 months. So imprisonment that was mentioned is the 6 months with a fine that may extend to 2,000 rupees or with both, and for the second or subsequent offence, if committed within 3 years of the commission of the previous similar offence, with imprisonment for the term which may extend to 2 years or with fine which may extend to 3,000 rupees or with both. Now recently in the Motor Vehicle Amendment Act, the amount of fine has been increased to the 10,000 and 15,000 rupees from the fine of 2,000 and the 3,000 rupees respectively. So this is the overall punishment defined in case of the drunken driving. Then another important section is section 85. We already talked when we were talking in the legal aspect with respect to the intoxication. Here in this section, if a person is involuntarily given the alcohol without his knowledge and his will, then he will not be liable for his action even if he commits certain crimes. This is preventing him from the punishment under the section 85 of the IPC. But if he consumes it voluntarily and with the knowledge, with his will, then he will be liable for his punishment if he commits any crime under the influence, that is defined under section 86 of the IPC. This 85 and 86 of the IPC are now the clause 23 and the 24 of the Bharatiya Nyaya Sanhita. Then the section 510 of the IPC, that is the public misconduct. Whoever in a state of intoxication appears in any public place or in any place which it is a trespass in him to enter and there conducts himself in such a manner as to cause annoyance to any person shall be punished with simple imprisonment for a term which may extend to 24 hours or with a fine which may extend to 10 rupees. This was a very old 1860s IPC. There the fine was only 10 rupees. Or with both the same section 353 in the Bharatiya Nyaya Sanhita, the change is the fine has been increased to the 1000 rupees and possibility of the community service has been included in the punishment of this 510 IPC. So if you create the nuisance, that is very oftenly done after the drinking, and in that case you may be taken in the custody of the police for 24 hours, and earlier it was the 10 rupees fine, but from the 1st of July it will be the 1000 rupees fine, or both may be there, or you can get away with the 1000 rupees of fine with your nuisance. So this is related to the public misconduct after the intoxication. Then the ethanol and the medical practice has an important correlation. Many times it is in the news that some doctors have been performing surgeries under the influence of alcohol, and for the staff who is on duty in the intoxicated state, in all those conditions there are service rules which prevents from doing so. And similarly for the doctors as well, there are certain sections that punishes as well as, and it is under the professional misconduct. So ethanol with respect to the medical profession, there can be the three situations. If a surgeon operates while intoxicated and the patient dies during the surgery, the surgeon can be prosecuted under the section 304A of the IPC, now 103 of the Bharatiya Nyaya Sanhita. That is, being drunk during the operation is a strong evidence of his rash and negligent act, that is recklessness. Then another situation is that a doctor can face a lawsuit if the patient suffers harm or death due to the negligent treatment. If the doctor was intoxicated while administering treatment, it further strengthens the case against him, even if he has not been done under the influence, but any of the lawsuit may be strengthened if it is found that he is in the having intake of the alcohol. So it will go against the doctor. Then another thing is that managing a patient under the influence of alcohol is considered professional misconduct. For the professional misconduct, the doctors may face the disciplinary action from the State Medical Council or the National Medical Council, including the possibility of being struck from the medical register. All these scenarios could be possible with respect to working under the influence or after the intake of alcohol. Similarly, it applies for the other government servants as well. Civil Services Conduct Rule prevents them from performing the duty under the influence of alcohol. This is all related to the ethyl alcohol. In the next class, we will cover the methyl alcohol and ethylene glycol. Thank you.